Hi, namaste everyone. So, as we are already discussed many of the psychological disorders, today we'll be discussing about the most important and most of you know about depression. Maybe not in detail, but you know depression. Okay, so today's topic will be depression. Depression is one of the very common psychological disorder. The meaning of depression is being dull, being depressed, sad, upset, feeling hopeless, feeling worthless and helpless. So hopeless is they feel there is no hope in the future and they feel themselves as a worthless, they feel themselves as a helpless. So that is the meaning of depression. Okay, now we see the definition. Definition which says mood disorder that leads to strong feeling of sadness and lacking interest on everything. So actually depression comes under a mood disorder. So mood disorder is also one of the kind of psychological disorder which explains about two episodes of mood, that is depression and mania. Okay, now we'll be discussing about depression. In the next video there will be mania. Okay, so it's a kind of mood disorder, or it's one of the episode of mood disorder where the person will be having a strong feeling, severe sadness and lacking interest in everything of his life. Okay, now we will see the symptoms. In the symptoms, first symptom of a depression is having no interest in any of the activities. The activities which a person used to enjoy in the beginning or before, maybe he loves to read book, he likes to go for trip, he likes to go for shopping, which he lacking interest now because of the depression. And also continuous low mood, so there will be consistent low mood. Okay, the person cannot enjoy, or he is unable to enjoy the thing, so he's having always a low mood. Lack of self care, not giving importance to his self care, also not taking bath regularly, not getting dressed better, not combing his hair properly, not wearing a clean dress, so lacking interest on the self care also. Then unable to concentrate on any of the work, so he's making too many mistakes nowadays because he cannot concentrate on any of the work and on any of the studies like before. And also having hopelessness and having lots of negative thinking, so he feels only he is having this problem, all others in the world are enjoying their life, all others are having a very good life, only he is having problem, only his life is like this. So having a lots of negative thinking. Worthlessness, feeling himself is not good for anything, and also having a suicidal thoughts and suicidal attempts. The symptoms which I have discussed in the beginning also available, it will be present in minor depression and also in major depression. But suicidal thoughts and attempts are, you can see, only in major depression, and it is very severe. So when a person is having suicidal thoughts and he had attempted for the suicide, that shows he is having major depression, which cannot be neglected. Okay, so causes of depression is genetic factors, biochemical imbalance, psychological factors and social problems. So these are the four major reasons which you can see in all the psychological disorders. So genetic factors, so it runs through the genes. All most of the psychological disorders runs through the genes. So for example, if a grandparents are having depression, or if a parents are having depression, there are chances of a third generation getting a depression too, or any of the psychological disorder too. Okay, and even it is proved in the survey. Okay, biochemical imbalance is the second one. Biochemical is also called as neurotransmitters. These are the liquid formation in the brain. Okay, and imbalance of the secretion of neurotransmitters will leads to psychological disorders, even a depression. Okay, there are number of biochemicals, namely dopamine, serotonin, epinephrine, norepinephrine, GABA, so many neurotransmitters. So increased secretion also leads to problem, and decreased secretion also leads to problem. Okay, then psychological factors and social problems are general aspects which makes you sad, like maybe death of a loved one, or major health issues, or accident to a loved one. So any financial issues, having problem at family, unemployment. Okay, all these leads to, or failure in the examination, love failure. So these are the things because of which a person gets into depression. but you should have in your mind, you should know that first two are the major causes of the depression, second two are the supportive causes and which contributes to the depression, like genetic, because of genes, because of biochemical imbalance a person get a depression, but these psychological factors makes it worse. Okay, so major causes are genetic factors and biochemical imbalance. Last one, the treatment. So as it is because of biochemical imbalance, because of genes, so there should be something which goes inside the brain and which helps them to feel better. So that's why the medicines are very much important. And in the major depression, medicines is compulsory. Without medication a person cannot lead a proper life. Okay, then counseling. So counseling is also important even in minor and major depression. Counseling is like individual counseling, maybe marital counseling, maybe couple counseling, maybe career counseling. So helps the person to overcome the depression. Then psychotherapy. Under psychotherapy there will be cognitive behavioral therapy, that is called CBT, REBT, rational emotive behavioral therapy. So where negativity is controlled and in the place of negativity positivity is substituted. So psychotherapy, even we'll discuss about the CBT and REBT in detail when we do a sessions on psychotherapy. Now the next one is supportive therapy. So along with the psychotherapy, along with the medication, the supportive therapies also helps a person to come out of depression. That is like dance therapy, maybe music therapy, maybe art therapy, drama therapy, pet therapy. So many of things in which a person is interested. Pet therapy is having pets at home will also help a person to overcome depression. Milieu therapy is changing a place also helps. And bibliotherapy, reading a good books, motivational books will also help a person to overcome the depression. So supportive therapy basically depends on a hobbies of a person. Okay. And last one is yoga and meditation. So yoga and meditation, a kind of yoga, a type of meditation which is helpful for the depression will be decided by the therapist. So if that is followed in a proper way, then it will also help a person to overcome the depression. So this about the treatment part. So till now we have discussed what is depression, the meaning, the definition, and the symptoms and causes, at the end the treatment. Hopefully our sessions are informative and it is helpful for you. Please subscribe to our channel as soon as possible. Thank you so much.